If you have crossed the age of 65 and you feel like you are in the best shape of your life, routine heart screening sounds like the responsible, proactive choice. But here is the chilling reality that the medical system won't tell you. For a healthy senior, a routine test can actually be a predatory trap. Every single year, thousands of vibrant Americans are being led down a dark corridor of false alarms, mounting anxiety, and eventually invasive surgeries they never actually needed. I am Dr. Cardiologist, and today I am pulling back the curtain on 4 specific heart screenings that top clinical experts are now warning seniors to reconsider. I'm going to show you how these tests start a biological chain reaction that can steal your independence. And I'll give you the exact power questions you must ask your doctor before you ever sign a consent form. Before we get to the list, I need you to understand a concept that is rarely discussed in a standard 7-minute office visit. It's called the cascade effect, and it is the single most dangerous pattern in modern cardiology. Imagine a perfectly healthy senior, someone with 0 chest pain, 0 shortness of breath, and plenty of energy. They go in for a simple checkup. The test picks up a tiny abnormality. But here is the secret. That abnormality is often completely normal for a heart that has been beating for 7 decades. After 65, your heart changes on a cellular level. It develops scars of experience that look terrifying to a computer designed for a 30-year-old, but are actually just the signs of a life well lived. However, once that machine flags a result, your doctor is often trapped by legal and professional obligations to dig deeper. They order a second test. That test is more invasive. It finds a shadow that requires a third procedure. Suddenly, the person who walked in for a checkup is being wheeled into an operating room for a surgery that the original science never supported. This is the medical domino effect, and it begins the moment you agree to a test you didn't need. I want to be crystal clear as Dr. Cardiologist. I am not telling you to ignore real symptoms. If you are experiencing palpitations, sudden dizziness, or chest pressure, you need to be in an exam room immediately. What we are discussing today is the vital distinction between diagnosing the sick and screening the healthy. These are 2 entirely different worlds, yet the healthcare industry often blurs the lines, leaving the patient to pay the price. Let's start with screening number 1, the routine EKG. We all know the drill: 10 minutes, patches on your chest, a jagged line on a piece of paper. It seems harmless, but the United States Preventive Services Task Force has explicitly warned against this for low-risk adults. Why? Because an aging heart has a unique electrical signature. When you run an EKG on a healthy 70-year-old, you will almost always find an irregularity. It is normal variation, but on paper it looks like a crisis. That false positive puts you on a conveyor belt toward an angiogram, a procedure that involves threading a catheter through your wrist or groin directly into your heart. That procedure carries a real risk of stroke, kidney failure from the dye, and arterial damage. You are risking your life to investigate a problem that wasn't actually there. The second trap is the exercise stress test for people without symptoms. You've seen this, walking on a treadmill while the incline gets steeper and the heart monitor beeps faster. Here is the clinical truth. If you can climb a flight of stairs right now without feeling winded or pained, this test is statistically more likely to give you a false alarm than a useful answer. The American Heart Association actually recommends against using this as a routine screen for asymptomatic adults. When a healthy senior gets a positive result on a stress test, it leads directly to a wire and a camera inside your heart. And once they are in there, if they find a partial blockage, a narrowing that has likely been there for 20 years without bothering you, they will often place a stent. Here's the part that will make you angry. Multiple landmark trials, including the famous ischemia trial, proved that for stable patients, a stent does not reduce your risk of a heart attack or extend your life any more than simple medication and walking would. You took all the risk of the surgery and gained 0 survival benefit. I want to pause here and ask you a very personal question. Have you or someone you love ever walked into a doctor's office feeling great, only to have a single test result turn your entire world upside down? Did you stop traveling? Did you stop playing with your grandkids out of fear? If you've been caught in this spiral, type TRAP in the comments. I read every single one of your stories, and your experience might be the exact warning someone else needs to hear tonight. We are moving to screening number 3, the carotid artery ultrasound. You see these offered for $99 at health fairs and community centers. It sounds like a bargain to check the pipes in your neck for stroke-preventing plaque. But the task force recommends against this for healthy seniors. Why? Because surgery to clean out those neck arteries, a carotid endarterectomy, actually carries a 2% to 3% risk of causing a stroke during the operation. For a healthy person, the risk of the surgery is often higher than the risk of the plaque. You go in to prevent a disaster, and the procedure itself creates one. I've seen retired postmen and teachers who were perfectly fine until a free screening nearly ended their independence. Finally, we reach screening number 4, the coronary artery calcium (CAC) scan for low-risk seniors. This CT scan measures calcium in your heart's arteries. It is a fantastic tool for a 45-year-old with high cholesterol, but for a senior, it is a biological mirage. Almost everyone over 65 has calcium in their arteries. It is a byproduct of aging, like gray hair or wrinkles. The scan can't tell the difference between stable calcium that will never move and unstable plaque that is dangerous. What it does do is generate absolute panic. You see a score of 700 or 900, and you think your heart is a ticking time bomb. You demand a procedure, your doctor feels pressured to act, and suddenly you're in surgery for a blockage that statistical evidence suggests would have never caused a heart attack in your remaining lifetime. As Dr. Cardiologist, I want to give you the ultimate weapon to protect yourself. Before you agree to any heart screening, you must ask these 3 questions. First, if I am feeling perfectly fine, how will the results of this test actually change my treatment plan? If the answer is it won't, then the test is all risk and no reward. Second, what is the false positive rate for this test in my specific age group? And third, what happens if we choose to watch and wait? Monitoring a stable finding is a legitimate, scientifically backed medical strategy. It is not giving up, it is being strategic. The goal of your healthcare should not be to find every wrinkle in your aging body. It should be to protect the quality of the life you are actually living. If this video opened your eyes, please share it with one person you care about. You might just save them from the medical domino effect. I am Dr. Cardiologist. Next week, I am revealing the daily habits that actually do protect your heart that no scan will ever find. I'll see you in the next video.